Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
What's your procedure for scheduling new patient initial exams? Beyond your normal intake process, how long do you schedule these patients for? An hour and a half, 2? And who do you schedule them with, the doctor or the hygienist? Obviously, they're going to have to see the doctor at some point, but do they see the doctor first or the hygienist first? When it comes to new patient scheduling, specifically with new patient initials, there's no real standard in the dental industry. I've asked roomfuls of dentists the same questions I started this episode with, and their answers are all over the place. And beyond this, if I were to take 2 doctors that each schedule a new patient initial for an hour and a half, a few things would be the same, whether it's a full mouth or a pan, exam, probing, etc. But what they do with the rest of the appointment could be completely different. So what is the best way to go here? And is there a particular way of structuring your new patient intake that leads to practice growth, increased efficiency, case acceptance, and better customer service? Well, that's what I want to talk about in this week's episode. I plan on going a bit granular on the subject, and I want to get into the pros and cons of their various approaches. I'll also provide a few guidelines that should help you determine which approach would work best in your practice. My name is Jeff Blumberg, and I'm your host, and I'm going to start this off with a little bit of a disclaimer before I jump right into it. My background and education are in business. I have worked with the dental industry for over 30 years, but I am not a doctor. So I'm in no position to render any type of clinical judgment on dental problems and how they should be diagnosed or treated. I leave that up to you as the clinician. That said, what I'm going to be going over with you today is something that we've seen, we've just had a chance to stay up on and be aware of and see our clients use. And we've been able to sort of work out, based on thousands of instances, seeing it with our clients, what tends to work best in a dental practice. But when it comes to the clinical questions, these are things that you have to handle for yourself, obviously. Now, I'll start with the simple stuff here. First thing is, what is the most common time a new patient initial is scheduled for? It's usually 1 hour, whether it's on the doctor or the hygiene schedule. It's usually an hour. The second most common is an hour and a half. I have heard 2. I have heard 2.5 hours. I don't know what you would do with a patient for that long. But look, if that works for you, then you got to do what is real to you and what works for you. The most common answer I get when I ask how long do you schedule for a new patient initial is an hour. Okay. I am seeing a lot more hour and a halves now than I saw in the past. What's interesting though is what people do in that hour and a half. The hour and a half most commonly was scheduled to allow time to do a prophy on the patient, after you've done the exam, charting, perio-probing, x-rays, and things like this. So it's not crammed, it's not too tight. But, I was doing a seminar recently and this subject came up. Should you or should you not do a prophy? Like, let's say you do an exam and you discover the patient has pretty severe perio. This is a new patient after all. You don't know anything about him. Should you do a prophy on that patient? And, became a discussion in the seminar. It was going to take us off track. It was going to go for a while, but it was a valid point. And, a lot of different doctors had different opinions on this. Some thought it might be supervised neglect. Others thought that they wanted to at least have the patient feel like they got something done, knowing that they still had perio, and so on. I'm not going to weigh into that because, again, you're the clinician. You have to make that decision. And I'm going to add, there's certain things you're not supposed to discuss in polite company, out in public. You're not supposed to discuss politics and religion. I'm going to also add to that list whether a patient should have a prophy if they have perio. I'm just going to – I don't want to bring it up. I'll leave that one to you. But anyway, what I've seen our clients do, and this is something that we've kind of been steering them towards for the clients that are using the hour and a half, is they're doing something a little bit different with the end of that appointment, which I'll get into as I get into the actual procedure here. Next simple thing is, should a new patient see the doctor or hygiene first? That is completely up to you. There is no right or wrong way. There are pros and cons to each approach, obviously, but it really isn't a deal breaker. I've seen offices that are very successful doing it either way. It's really a personal choice or a decision. It really doesn't matter. Okay. Now, let's just focus on this as I start to break down this hour versus an hour and a half, because I think personally they could both have a place in your practice. But to kind of show you what I'm talking about here, let's walk through the whole process here for a second. Let's start with the new patient intake, right? So the first thing is, and I'm not going to get into the phone skills here on this as far as new patient conversion. We have other episodes on that. We also have a whole course on our online platform, DDS Success. I'll put a link to it on the episode webpage on phone skills if you want to train your receptionist on this. But the most important thing with new patient intake is you have to be able to get people in quickly. Okay. If I call your practice for a new patient initial, hi, I've just moved to the area, or hi, I'm looking for a new dentist. I'd like to get my teeth cleaned, and I can't get in within 24 to 48 hours, that is a huge problem. I want you to realize that is a large red flag. And if you don't know how long it takes to get a new patient into your practice, you should go ask if you're the doctor. Go to your office manager or whoever does your scheduling and say, hey, if a new patient were to call in today and wanted to get in, when's the first time we could see him? If the answer is 4 days from now, a week from now, you have a problem. And I'll tell you why, especially if you're doing any kind of marketing. When someone is calling off of any kind of marketing, whether they Googled you or they found you on Facebook or they got your postcard in the mail or whatever it might be, the connection they have with your practice is very, very minimal. Okay. They don't really know you from anything. They got your card. There's no connection. It's not like they were referred to your office because their wife is already a patient. So you have to be able to accommodate that person as quickly as possible, because let's just play this out. I found you on Google. I saw dentist near me. You came up. I clicked your Google ad and I called you and I asked when I can get in. I can get in 10 days from now. All right. Well, I really was hoping to get in sooner, because I want to get my teeth cleaned. What am I going to do next? I may or may not make the appointment, but then there's a really good chance I'm going to hang up and call the next person on the list. And if they can accommodate me sooner, I'm probably going there. Okay. Maybe they're not as close as you are, but it's not that big of a deal to me because they can see me day after tomorrow, because we have no connection. If I'm a referral, again, I might be willing to wait. It's just not good customer service. So you want to make sure you can accommodate people quickly. If you can't, you're torpedoing your marketing. You need to fix that as soon as possible. But then, all right, regardless of that, when they come in, what am I doing during this initial? There's the normal process, full mouth or a pan or whatever you do, a cone beam or whatever. You're going to do perio probing, and then the doctor is going to have to come in at some point, whether they're seeing the doctor or the hygienist, one way or the other, they are seeing the doctor, is going to have to come in and do an exam and charting. Okay. That's what you're going to go in there. You're going to do that. You also have to meet the patient. Now, here's where it gets interesting, and this is where it contributes to overall case acceptance, and it's just better customer service and practice expansion. And I've talked about this on other episodes. One of the big problems with the 1 hour appointment is if you time it out, let's say you're going in for the last 20 minutes of this 1 hour appointment as the doctor. In 15 minutes, you've done your exam charting and you've gotten to know the patient a little bit. You have 5 or 7 minutes at the end of this appointment if the patient needs an extensive amount of treatment to present that treatment plan. And the biggest mistake is in 5 to 7 minutes with a larger treatment plan to present that treatment plan, if that's all the time that you have. That is not enough time to close an extensive, large treatment plan. So a lot of doctors will do it. They'll sort of short circuit it and present it real quick and send them off with the treatment coordinator. And then the patient doesn't close. And then they end up on your incomplete treatment list, which, I was doing a seminar recently. I asked a couple clients there what their incomplete treatment list looked like. And these are very successful clients, mind you, $5 million, $2 million. I invite you to go check this out for yourself. How big is your incomplete treatment list? Now, if you ask your scheduler how efficient the incomplete treatment list is to fill openings in your schedule, they will tell you it is terrible. Once in a while, they will get lucky. They'll call a patient on the incomplete treatment list to fill an opening, and the patient will want to do it. The majority of the time, they're still thinking about it. They'll talk to you next time they're in, and so on. Okay. So the idea is we want to be able to close this patient. In order to close this patient, from a sales perspective, I need time. So one thing I've talked about in the past is if I'm running this 1 hour procedure, I don't have time to present now. Let's say you do this, you get to the end of the exam, you're 54 minutes or 53 minutes into the process, the patient's appointment, and you're doing another room in 7 minutes from now. Or let's say you're not doing another room. The patient has to leave. Let's say the patient arrived at, 11, and they have to leave at noon hard because they have an appointment afterwards. So you don't have time to present. You need to bring this patient back for a consultation. All right. And, how long or what would justify a consultation. The idea of a consultation in the past was always like an FMR case or an all on X, something really large. I would have you think of it a different way. In the business world, what we would call a consultation is basically a nice way of saying a sales opportunity or an interview. It's basically a sales opportunity. So, because that's essentially what you're doing. You're selling the treatment plan. And sales isn't just about talking money. It's about explaining what the person needs to buy, right? So I need enough time to close this case. So I'd bring them back for a consultation. Now, how big of a case? For some people, a $4,000 or $5,000 case, $3,000 case, $3,500 case, that's a lot of money. Think about it for a second. If your patient makes $70,000 a year and it's a $6,000 case, that's 1 month of income. It's actually a little bit more than 1 month of income. That requires a discussion. That's probably 20, 30 minutes. If they don't have it now or you don't have it now, you need to bring them back. And I've covered this before. Usually you bring them back first thing in the morning or first thing after lunch the next day or the day after. You have to be distraction free as the doctor so you can explain what they need and answer their questions. The cons of this approach is there is a potential issue in that the person may not come back. Now I can do a few things to, encourage the patient to come back. Number one, as the doctor, I could try to schedule the appointment or at least encourage the patient to schedule, hey, I've finished your examination. I'm going to bring you back for a consultation appointment where I go over what my findings were today. I wouldn't say, by the way, I had somebody ask me, should I say I don't have time to see you today? Absolutely not. That's a terrible idea. I would just tell them you need to bring them back for a consult. And they ask you, well, why can't you tell me today? You can tell them, look, I'm going to study your x-rays, study your case. I want to make sure I come up with the correct treatment approach for you. Make sure you give me a little bit of time, but I'd love to see you back first thing tomorrow morning or first thing, let's say today's Tuesday. I want to see you first thing tomorrow morning, Wednesday, or first thing on Thursday morning. Do I have any appointments available? You can ask your assistant. Yeah, doctor, we have a 9 o'clock appointment available on Thursday. Could you be here at 9 o'clock on Thursday? Yeah, sure, doc, I can. Great. Right? And you bring them back. I wouldn't start presenting the case. Oh, well, you need 2 root canals and, 6 crowns, because now the patient's already thinking with it. Let's just get them back and do the consultation. That's one of the liabilities of the 1 hour appointment is it doesn't build in sales time. This is where, especially with our clients, we sort of moved in the hour and a half appointment in that we bake in presentation time to the new patient initial. So we're not using that last half hour for anything other than a treatment presentation. So in this case, you've done your examination, your charting, etc., and you're 53 minutes into an hour and a half appointment. At that point, it might be, okay, good, let me just take some notes here. We're going to move over to my chair or move to my office and I'll go over with you what I found. Well, that's great, right? You can just boom, do it right there. So that's the advantage of the hour and a half appointment. The hour stays the same. It's actually really what it is it's an hour. If let's say, for example, you're seeing new patients on the hygiene schedule, essentially what you're doing is you're still doing that normal hour on the hygiene schedule on the hygiene schedule with the new patient. And it's really a half hour after that hour on the doctor's schedule for the presentation. Do you see? So that's the advantage of the hour and a half over the hour. Now, let's just take a look at this, though. We're actually looking at we're looking at patients with different situations for each type of appointment. So let's say I call into the office and I'm 23 years old and, I just got out of school and I've been on, I was living out of state and I was seeing my doctor every 6 months and I've never really had any dental problems and never had a cavity. Nothing hurts. I have all my teeth. And I just want to schedule to get my teeth cleaned. Do you schedule me for an hour or do you schedule me for an hour and a half? Well, you'd schedule me for the hour because there's a really good chance the doctor doesn't have anything to present to me for that last half an hour. Do you see? Maybe I need an occlusal composite, in which case that's not a consultation. That's a quick conversation. Hey, you need a filling, talk to the front desk, right? But let's say instead I call in and I'm missing 3 teeth and I have a toothache right now and I don't like it because a number of my front teeth are chipped. Well, I may have more extensive treatment to do in that instance, in which case you might schedule me for the hour and a half. Do you see this? So ultimately, if you're going to implement this concept, the hour and hour and a half appointment, you have to at least have an inkling, if you want to use this hour and a half tool, that the patient could potentially need extensive treatment and end up on the doctor's schedule. Now, are you going to know? No. And of course, you can't diagnose anything because the person talking to the patient is the person at the front desk. It's the scheduler, new patient coordinator, etc. But there are a number of questions you could ask to at least give you an idea that, yeah, it would be a good idea to schedule this patient for an hour and a half. Essentially, what you're going to have to do this, if you want to try this out, is you need to up your intake game. And the person who's handling these calls has to be extremely sharp. You know, for instance, if you're doing an implant funnel and you have patients calling in on missing teeth, obviously those patients you probably bring in for the hour and a half because you already know they have a situation, they're missing teeth. They're going to need some implants, especially if you do implants, right? But if you're trying to sort of winnow out whether this person needs extensive treatment or not, it's kind of a weird thing. I know, because you're just trying to get an idea. Does this patient have dental problems where it might justify the doctor spending an hour and a half to present a treatment plan to them, where they might have, or they may need extensive treatment? That's really all you're trying to determine, or at least have an idea of. Because what you don't want to have happen is that 23-year-old with no dental problems to be scheduled for an hour and a half, and they're sitting with the doctor after they do their exam and x-rays, right? And there's just nothing to do. It's like, oh, I guess I can leave now. They've even had the prophy done because the hygienist got done so quickly. You don't want to have that person scheduled for an hour and a half, because then you have the doctor sitting around cooling his jets or her jets for a half hour with nothing to do. So this is where you need to up your intake game. So this is where I would take a look at the intake form you're using for any new patient, whether it's a call-in or somebody that you're calling. I have a sample of a new patient call-in form. I'll put it on the episode webpage. It's from our online platform, DDS Success, from the phone skills course. And I'm not going to read the whole thing, but I want to cover a couple of the questions on it so you kind of get an idea of what I'm talking about. Has the normal stuff, you know, when did they call, what's their name, what's their address, what's their phone number. I have how did you hear about us? And if you listened to the episode 2 weeks ago, you know that I have a pet peeve on this. You really need to drill down on how they heard about you so that you can make sure your marketing works. Then I'm going to ask questions like, when was their last dental visit? Then I have a question like this. When you last saw the dentist, was any treatment recommended? And if so, did you proceed with it? What if they say, well, yeah, the last doctor told me I needed 4 crowns. Well, did you do them? No, I didn't feel comfortable, so I didn't do them. And they've seemed okay. I mean, I know I need to get those teeth looked at. Okay, good. You could then ask if there's a doctor you can contact for any recent x-rays, if it's a second opinion. And then I would ask them questions like this. We have this on the intake form. Do you have any discomfort or any other dental concerns? This is all part of the new patient intake, right? Well, yeah, you know, when I chew on the right side, it kind of hurts on the upper right. And, you know, from time to time, my back tooth on the bottom jaw in my mouth, I'm talking like a patient would, I'm not going to say on the lower arch, right? On the bottom jaw, it tends to hurt, you know, and it just goes, it hurts and then it stops hurting and I don't know why. And there seems to be a really dark spot on it. Okay, good. And then you could ask them something like this. Is there anything that you'd like to discuss with the doctor or that we should know to make your appointment more comfortable? Yeah, you know, my teeth are crooked and I really don't like my smile. So I'd like to talk to the doctor about one of those aligner things, you know, because I've seen a lot about those and they seem really cool. I never got braces and I probably should have when I was a kid. Okay, great. Then you ask the normal other questions about insurance and pre-med and allergies and things of that nature, and then you schedule the appointment within 24 to 48 hours. So if I'm hearing all this stuff from a prospective patient, right, and this is where your receptionist has to be sharp, someone like this with the answers I gave would probably be an hour and a half appointment. They're going to end up in hygiene. They're going to get all their diagnostics. The doctor is going to roll in, do the exam and the x-rays. Then he or she is going to walk over with that patient to wherever they do the presentation, probably not in the hygiene op, and either their operatory or their consult room, and present a treatment plan to a patient, and you get it all knocked out in one day. But if I ask these questions, it's, you know, all the answers are no, very happy, you know, not a big deal, et cetera, then that person's probably going to be scheduled for an hour. So you're asking your receptionist or whoever handles these calls to be a decision point. So you better make sure if you're going to do this, that this person really knows their stuff and can make smart decisions. Because here's the funny thing. It's not a big deal if somebody who should have had an hour and a half appointment ends up as an hour appointment. The worst that's going to happen is exam, x-rays, everything's going to be done, and you're going to realize you have to do a treatment presentation that you don't have time for, and you're going to have to bring the patient back. That's the worst outcome or worst case scenario. Not a big deal, okay? Whereas if somebody who should have been an hour appointment ends up as an hour and a half, you've just blown a half hour on the doctor's schedule. So that's sort of the guidelines I would have you end thinking with if you end up doing this, right? Now, what are some of the pros and cons? The pros of the hour and a half, obviously, is you can present same day. It's good for the office and the patient. It's more convenient for the patient. The only cons, I would say, the negative aspects of the hour and a half appointment is if you have a no-show, it's a little bit more impactful than if you have a 1 hour no-show. That only affects the hygienist, whereas an hour and a half no-show also affects the doctor, right? And the only thing you could run into is you might be missing a decision maker. So let's say I come into your practice, your receptionist asked me a lot of good questions about, and your receptionist has determined there's a good chance I'm going to need more extensive work. So they make me one of those hour and a half appointments. And by extensive, this could be a $4,000 or $5,000 case, folks. It doesn't have to be a $15,000, $20,000, $30,000, $40,000 case. Because that, again, if it's going to be a large purchase, depending on the purchasing power of the person you're talking to, that's probably going to require a discussion. But in any event, it's been determined I'm an hour and a half appointment. So I get my exam, everything's done. We go off. You tell me all about my treatment plan and we get to the end and I go, yeah, doctor, this sounds great. But I'm going to have to talk to my wife about this. Now, in other episodes, I've talked about what a real objection versus kind of a faulty objection. Let's say this is a real objection. I just can't pay you or I can't make a commitment without discussing this with my wife. So we've now got a problem. Maybe not a problem is it's a strong word to use, but we now got a little bit of a hitch. That's a better way of saying it. It might be something where I say to you, well, you might ask me, well, first off, Jeff, is this something that you want to do? I go, yeah, absolutely. I want to do it. Well, then let's just go ahead and do it. No, look, you don't understand. If I don't do this, if I just go ahead and do this without talking to my wife, I'm going to be sleeping outside. And you go, okay, well, let's not do that. And you go, well, what do you think she's going to say? And I go, it's fine. It's just a matter of I have to tell her she's going to be fine. She understands. I'm comfortable doing it. Okay, no big deal. Your treatment coordinator follows up with me the next day and I'm on the schedule. Not a big deal. Or I might say to you, yeah, I don't know. My wife is going to be a bit concerned about the fee associated with this. I don't know what she's going to say. Well, in that case, you now have a bit of a problem, right? This is assuming I really want to do the treatment plan in the first place, but I could be really excited about it, go home, and my wife kind of, kills the deal, so to speak. But why would that happen? Well, think about it for a second. You spent a half hour with me explaining this treatment plan in full and answering all my questions. You're now expecting me to go home and tell my wife the same thing. The only thing she is going to have complete understanding of on that treatment plan sheet is not the procedures. She's going to understand the fee because everybody understands money and that price tag is too big for her. Okay. So in that case, what I would do, I've had some people ask patients to call their wife. I wouldn't be super comfortable with that. That's just me personally. What I would probably do if I felt I needed to speak to the wife so the wife fully understood or the spouse fully understood, what the treatment plan was so that they could all make an educated decision, I'd probably offer this up. I'd say, listen, we've sat down for a half hour. I've explained everything to you. And my only concern is, your wife hasn't been sitting with us for this whole conversation. And I want to make sure she understands the importance of what I'm explaining that you need to do. So here's what I'm willing to do. And this would be the doctor talking. We could either set it up where you bring your wife back and I explain the whole treatment plan again and answer any questions, which I'm happy to do. I can do it in person or I can do it over Zoom, whichever works best for you. It's important to me that you get this treatment done. And I want to make sure that your wife understands it so that she realizes why it's important. Okay. In that case, then there's a couple advantages. Number one, maybe the spouse isn't a patient. Right? I mean, in that case, that's pretty cool. I might be able to get a new patient out of the deal. If anything, I would want for the spouse to be supportive, or in this case, if you're talking to me, my wife to be supportive. You wouldn't want my wife hating on the fact that I signed up for a treatment plan in your practice, right? So that's the only con beyond, the bigger no-show time of the hour and a half approach. The only other con is if you're scheduling people, whoever's doing the intake at the front doesn't know their stuff and you're scheduling people who really don't need the hour and a half appointment in that hour and a half slot. Okay. That's the only other potential con if your receptionist isn't trained enough in order to pull this off. As far as the pros and cons of the 1 hour appointment, I mean, The pros are it works. It's been being done for a while. And it's because it's only an hour, it's easy to replace with another hygiene appointment. The only con is if you do find extensive treatment, you have to bring this person back, which in some case can be, not convenient, or you could potentially lose this patient, not lose them permanently, but they blow off their consult appointment and don't come in. Anyway, wanted to get a bit granular on this one particular point because it's something that's been floating around. And I think if you implement this correctly, it can actually be very beneficial to your practice. If it were up to me, I'd advise, depending on the amount of new patient inflow you have in your practice, I think there's a place for both of these approaches, an hour, hour and a half in every dental practice, as long as you use it right. Anyway, shorter episode this week. I do hope it helps. I have a copy of that new patient intake form if you want to download it and use it for your practice. Remember, it is a sample, so you make your own version, right? And I do have a link to that phone skills course on DDS Success if you want to check that out as well on the episode webpage. And if you have any questions about this, you can always email me at jeffb@mgeonline.com or find us online at mgeonline.com or call us at 800-640-1140. That's all I have for you this week, folks. I hope it helps, and I will see you at the next episode. Have a great week.